Very pleased to say that I'm joined in the studio by Faye Biggs. Now, Faye is from the Horder Centre and she's come to talk to us today about thrombosis. Now, thrombosis is one of the leading causes of deaths worldwide. 1 in 4 people dying from that condition, and probably not enough people think too seriously about it. So it is a serious issue, and in an attempt to increase awareness, there was World Thrombosis Day, and that was the 13th, so it was just the end of last week. So we're kind of counting it as this week. And here to tell us more and to help us understand this condition is Faye. Faye, welcome to the studio.
Thanks
for coming in. It's good
Lovely
to see you.
Here.
So you've come all the way from the Horder Centre.
I have, all the way down that road to here.
So what do you do at the Horder Centre, first of all, Faye, before we talk about this?
I'm a clinical services manager there, so I look after all the clinical input of the nurses and the medical work that goes on to make sure everything's in tip-top condition and everyone has the best experience possible. And we stay up to date with all our up-to-date techniques and research-based methods. So that's my involvement there.
You're a busy lady then.
Well, quite a bit.
And you spent the time to come over here, so thank you for coming over. It's
very
great that you
welcome.
come. So thrombosis, first of all, what is it?
Well, thrombosis is the medical term for a blood clot. We have different types of thrombosis. Basically, we can have an arterial thrombosis, which is a blood clot in the artery, or we can have a blood clot in the vein, which is called a venous thrombosis. But most commonly, people have heard of blood clots forming in the deep veins, sort of in the calf muscles, and they're called deep vein thrombosis, or a DVT, basically. And they're normally what we've heard of from people flying long haul and being cautious of what they need to do. But what's not known is that this can happen to quite a lot of people, and we all have some of the risks and some people more than others. So the point of me being here today was to really increase the understanding of blood clots and what we can do to prevent them from happening. And these blood clots happen when something slows down or changes the blood flow in the body. And this slowing down results in the blood thickening and then clumping together, which forms a clot. Now, once that clot is formed, it can slow or even block normal blood flow. And that's when it gets very serious, because when this happens in an artery or a vein, it can lead to a heart attack, a stroke, or life-threatening clot in the lungs. So that's really what thrombosis is. So it's just a medical term for blood clots.
It's really scary, isn't it? When you put it that way, I'm thinking, I mustn't cross my legs. I must keep running around. I've got to run. I sit in the studio for 3 hours, and sometimes I actually don't move very much. Well, apart from I'll jig about and hear a good record. Yeah. But you don't think about it. It's something you're not really aware of. And yes, you're right. When we fly, it's on your mind. You're told you're supposed to exercise with your ankles and wiggle your feet about and do what you can to move around. And I'm a particularly tall person, so I find moving my legs really difficult. So I start to panic on a plane, thinking I've got to get out. Then I'm next to the window and I can't get out. And I'm thinking, oh my God, I'm going to sleep. Awful's going to happen. But people don't realise that that's not just when you're at risk. It's just like me sitting in the studio for 3 hours.
Absolutely,
is a bad thing.
Absolutely, and when people think it's something that elderly people suffer from, but actually it's not. It can affect anybody at any age, and that's why it's good to make that awareness of it. I mean, I can talk about some of the risks and who's at risk. Who's at risk?
Does your risk increase as you get older, or does that is age not a factor?
Age is a factor in that being older than 60 is can be a predisposing factor to it. But,
right. Oh, that's nice to look forward
to. We can't blame that, because we can blame age on everything, can't we? And I certainly blame it to what's happening to my body. But in actual fact, there are quite a few people at risk that we wouldn't even think of. The obvious ones are those who are having prolonged bed rest, such as being ill or immobile for a while. And that's not just in hospital. That could be at home as well, with the flu, or laid up in bed for a week. Pregnancy is something we think of. Low risk because people are young and healthy, but pregnancy increases the pressure in your veins, in your pelvis and in your legs, and that risk continues not just up to having the baby. That's 6 weeks post having the baby as well. Yeah, so it's something to still look out for post delivery. People taking birth control pills. Smoking is the obvious one. Smoking will be there for everything, unfortunately, so we've got to add that to the list, as being overweight, because again, being overweight increases the pressure in your veins, in your pelvis and your legs again. Some people, there is a family history of auntie or granddad had a deep vein thrombosis, so that's another risk. Some inflammatory bowel disease such as Crohn's or ulcerative colitis can be another one. But as we say, it's surgery. You know, at the Horder Centre, we do an orthopaedic hospital, so we do a lot of hip replacements, knee replacements. So we're very on top of looking out for signs and risk assessing for everybody every day and every 12 hours whilst they're with us. So sitting for longer periods of time. So as we talked about, you and your flights.
Yes.
Did you go anywhere nice, by the way?
No.
I'm trying to think if I've been on a long haul flight that I needed to get up and exercise. I don't think so. Not to have words with my husband.
I used to live in Canada, so there were really long flights, and we were flying back and forth to see our family quite a lot. So we were flying a lot, and we also lived in a very high altitude place. Does altitude affect where you're living? Does your blood thin? Like I know when people climb Everest, their blood thins.
Well, you get people training, don't you, up higher?
You do.
The better absorption of oxygen.
So as your blood thins, is that a good thing? As your blood thins?
Well, you're less risk of the blood clumping together and clotting together with it being thinner. So that's why people are wanting to drink regularly and keep hydrated a lot as well.
And is that important? Keeping hydrated?
Absolutely. Yeah,
because has attitudes changed, or the way that we nurse people in hospital changed over your career, Faye, as a nurse? Because I'm only thinking about my mum when she had me. Yeah. She was forced to stay in bed for like 7 days after the birth, and was not allowed, had to use a bedpan, was not allowed out of bed.
You had to stay still.
Absolutely.
Yep.
So how has it changed?
It's changed a lot. I mean, people having babies are in and out of hospital in the same day. Yeah. And my mother had a hip replacement 20 years ago, and she was in hospital for 5 days. Now, people with us who have hip replacements or knee replacements, they're up and out of bed the same day.
Gosh, really?
Moving and mobilisation is really important, not the sitting down in the same position all the time. So yes, any exercise that keeps people moving and keeping their blood flowing so they're not still for long periods of time. So yes, it has changed in hospital. And in fact, that's one of the preventative measures that's put in place in hospital now, in that a healthcare professional will always carry out a risk assessment, and that looks at the potential that you've got of having a blood clot. And this tool that's used to gather that information will take into consideration your age, your medical history, your lifestyle, and then it will tailor your treatment or care that's given to you based on your risk. So if you or a relative are admitted to hospital for a period of stay and you don't receive such an assessment, this can be anywhere. It doesn't have to be surgery. It could be any relative that you have that goes into hospital or is poorly for a while. Be proactive. Ask for an assessment to be done to rule out the risks of a thrombosis. It's not wrong to do. It's what hospitals should be doing to look after their patients in their care and to alter or adapt treatment as required.
It's always to be mindful of it, I guess. So if you suspect that you how would you know if you are at risk, or if you think you might have something going on in your legs or wherever? Is it your legs particularly you would feel it?
Well, most common people feel it in their,
and what would you feel?
In their legs. You might have lots of different symptoms, and you can't say one thing is definitely that. So you need to be aware of a lot of things. But a sign of a deep vein thrombosis, let's talk about those. You could have pain or tenderness in your calf or your thigh that's really quite sore to touch, and you might even have some discoloration or warmth at the same site. There could be swelling of the leg, the foot, and or of the ankle. And another symptom can be shortness of breath. But any of these symptoms, you need to be treated urgently, and you need to go to the accident emergency department at your local hospital.
So that would be if you've had surgery. But generally, if you get those,
that's generally for anybody, not just surgery. Anybody who's been unwell and been in bed for a while, not able to move, and then all of a sudden they get a pain in their calf or some reddening and some soreness, then absolutely. Need to go to hospital just in case.
Yeah, it hadn't occurred to me how serious it was. You know, it's quite a frightening statistic, isn't it? So many people do die of this condition. Yeah, unnecessarily, really.
It is.
You just need to watch the signs.
It is, because a lot of it can be preventable as well. I mean, we can all do things to help ourselves. We can all cut down smoking, lose weight if we are overweight. You know, if we're at an office desk, get up every 20 minutes, go and make that extra cup of tea or coffee, or say hello to your colleague rather than sit there. And in fact, I always use the excuse of my husband's watching football at the weekend and I want him to do something that I want him to do. It's right, you've got to get up now because you run the risk of if you sit there for too long.
That's a great one.
That's a great one.
Get my husband to do the Hoover.
Yeah, he doesn't quite listen to me though. Something's going wrong there. But it is preventable. So we do need to look out for ourselves and keep our circulation going, keep moving, because the blood clots that form in your calves are if your calf muscles don't move for long periods of time. So if your muscles don't contract, that normally helps your blood circulation. So if your muscles aren't contracting, the blood slows down in the area, and that's when you're at greater risk of.
So wearing stocking socks, things like that when you're on a flight, does that help?
Well, yes, that's something that we do in hospital. So there are a couple of things you can do if you have a high risk. Certainly, individuals who are deemed at risk should be given appropriate prevention treatment. And prevention treatment is known as prophylaxis. And this treatment can either be in the form of anti-clotting medicine, which is commonly known as blood thinners. Everyone hears of them as blood thinners. Or if you're in hospital, sometimes we'll use medical devices, and compression stocking is one of those. And at the Horder Centre in Crowborough, we also use foot pumps, which stimulate blood flow to the ankle,
gives your leg a bit
to
of a
the
massage.
foot. Yeah. And as we say, every day patients are risk assessed and given an exercise regime, which includes getting in and out of bed every day to encourage mobility, and then further classes and physiotherapy. So let's keep moving, everyone.
That's a perfect moment to stop then. Faye, thank you so much for coming. We've actually overrun. I'm going to go and do the travel, and then I think we need to have a bit of a dance or something. We need to move.
We do. I need to make another tea or coffee.
We've sat for far too long. Faye, thank you so much.
You're very
must
welcome.
come in again. We'll find another subject and get you back in again. We could do a weekly health slot.
Oh dear. Well, thank you for having me.
No, it's brilliant. Thank you very much.
Bye-bye.
You've got to go back to work now, haven't you? You're very, very busy. Right, travel. Let's do that.
Uckfield FM, traffic and travel. FM.